answering those questions later on. So to begin with, I'll introduce Amy Smith. So she's a psychologist and one of the directors of Therapy Central, which are a clinic based in London. So I'll let you kind of give us a brief overview, Amy, of what you do, how you got there, and your current role as a therapist.
Okay, no problem. Firstly, hi everybody, welcome. So I'm Amy Smith. I'm a counselling psychologist and also one of the directors of Therapy Central, which is a private service providing counselling and psychological therapy. So Therapy Central is based in Oxford Circus, although I haven't quite seen the practice for a while given the lockdown. So we've been doing lots of therapy online. It's been working really well, and we're hoping to soon return back to the practice a little bit more and see people face to face. And at Therapy Central, we have around 15 therapists working with us. Majority are psychologists, so either clinical or counselling psychologists, and we also have one psychotherapist. And we support people with a range of emotional struggles, so anything from like anxiety, stress, depression, and so forth. And also myself and some of the other therapists, we have expertise supporting people with a range of physical health problems, so including chronic pain. So if I say a little bit about my background in terms of like my education and briefly about my career up until this date. So did my undergraduate degree a few years ago now in psychology, and then after that I worked in various different settings, so both private and NHS settings, supporting people with a range of emotional struggles. And one of my jobs was I worked for a clinical health psychology service in Dunstable and Luton. And so that's where I provided both individual therapy and group therapy for people with a range of physical health problems. And within that service, we had a pain management service, so obviously people with chronic pain. And so my role there, so I was the lead for the service for some time, and we were part of a multidisciplinary team. So it was myself working for it, for the pain management service, as well as we had a physio, occupational therapist, and pain nurse specialist. And we offered individual psychological therapy, but we also ran a group program, multidisciplinary group program for people with chronic pain. So following this, I gained my doctorate in counselling psychology, and following that, I worked for the fatigue service at the Royal Free in London, so supporting people with ME or chronic fatigue syndrome. And so lots of people with ME, chronic fatigue syndrome, they also have chronic pain associated with their fatigue. So in that service, I helped a lot of people with managing their pain alongside their fatigue. And also after doing my doctorate in counselling psychology, I developed Therapy Central, so private practice with two of my friends, so Rafaela and Sheetal, who are also psychologists, and we trained together. So yeah, that's a little bit about my background, education, and career.
Nice. It sounds like you have lots of experience in chronic pain. So I guess we'll crack into it and we'll talk a little bit about chronic pain. So for those of people that don't know what chronic pain is, it's essentially pain that is persistent and can last more than 12 weeks. And pain is very complex, so chronic pain especially. So it just doesn't mean that you have damage. Sometimes you can have pain without damage, and I'm sure you'll elaborate on that, Amy. But a lot of patients that we get, they've injured their physical aspect. They might have a knee injury, and after 12 weeks of continuous strength training, they might still find that emotionally they're not over that pain, and no matter what they do, they can't get over that pain. So from your experience, how would you explain what chronic pain is, and what are the common symptoms and features that you see of chronic pain, Amy?
Yeah. Well, firstly to say that it affects a lot of people. It affects, I think the stats are 1 in 5 people experience chronic pain, and it can be for some people really debilitating. So in terms of the yeah, so it's a really important point to think about this. Pain doesn't equal damage. I mean, it is quite a common myth that the more pain you have, it's thought that the more damage there is in the body. But there's been so much research into this, and there is no direct link. And it seems quite surprisingly, no direct link between the amount of damage in the body and the amount of pains experienced. So, for example, if I had a small cut in my leg and you had a large cut in your leg, you'd expect you to be in more pain than me. But that's not always true. Okay, so that suggests that there's a whole range of other things that can come into it that can contribute to the pain experience. And I guess, yeah, the other thing to mention about the pain doesn't equal damage is that there's people with, you can see it on sort of scans, that who have quite significant degeneration of the spine, but then have absolutely no pain whatsoever. And the other thing is that sometimes there's no identifiable cause for somebody's pain, so we can't detect it, but yet that person can be in a lot of pain. And we even know that there's some people who are missing limbs and they can experience pain in the area where their limb used to be. So this is more and more evidence that suggests that, yeah, pain doesn't equal damage. So if you're experiencing chronic pain, I know that might all seem a bit confusing, but I think the key message to take away from that is, well, be reassured by it. So a lot of people with chronic pain, I understandably worry that there's damage going on in the body and they've got to be really careful. But it's good to keep in mind that pain doesn't equal damage. Usually we have to do something really quite significant to cause ourselves damage, like fall down the stairs or something. So yeah, reassure yourself that you're not causing damage. So it's tough to have pain in itself, but you don't want that added anxiety that you're causing yourself damage. So a little bit.
I was going to say, I definitely agree with that. Like a lot of clients we get, they always are requesting the MRI because they want to see, you know, if they've got that physical damage. But often, even though, you know, we recommend going to the strength training, seeking help, they go for the MRI, they come back and they still don't know what's wrong with them. So it's really interesting in that sense where, again, it shows that pain does not equal damage, like you said.
Yeah. And there can be a tricky thing with this, that it's understandable to, if you have chronic pain, to want to figure out, well, what is going on, to try and find the cause of it, and then hopefully that would inform some kind of treatment to get rid of the pain. And for some people that works out fine, and they do figure out what the cause is with professional help, and then they can get some treatment. But where sometimes there's either people have some kind of something going on structurally that is accounting for the pain, or some people don't have any identifiable cause for the pain, regardless of what situation you're in. There are some people who spend a lot of time and energy and money on trying to find the cause and of the pain and treatment, again, which is completely understandable. Pain isn't pleasant and it has an impact upon your life that isn't great. But it becomes tricky. I mean, I've known people who they're 30 years into trying to find the cause and to find a treatment that works. And as a result, it just takes up so much of their lives and it takes time away from other things that could be more valuable and enjoyable in life, rather than going to all these hospital appointments. And people can spend a lot of money on investigations and treatments. So again, it's completely understandable why people would do that. Again, pain isn't pleasant. You don't want to have it. You want to figure out what it is and get rid of it. But I would also just ask people to reflect upon the extent to which they're putting time, energy, money into figuring out the cause and treatment.
Exactly. And I think, just like you said, like with pain, there's that suffering that people go through, and often it's magnified, and understandably, of course, you know, you have anxiety, you get like that fear avoidance, and especially from my experience with patients with chronic pain, having had it for so long, they go through different phases of trying different things, holistic therapy, going to, you know, other forms of therapy, and they don't find the answer. And that in itself can be really debilitating and make you even more anxious, more fearful. and there's that kind of psychological aspect where actually that physical pain has made you feel even worse psychologically, in terms of getting anxiety, having fears. And what are common signs and symptoms that you've seen of people where they start to think and feel even worse and worse, and it kind of spirals out of control into even more kind of conditions like depression? Have you noticed that quite often, or not?
Yeah, yeah, absolutely, yeah. So yeah, it's really tough because the pain itself is unpleasant, but it often doesn't stop there. So there's a strong link between our physical well-being and emotional well-being. So with chronic pain, understandably, it can have a negative impact upon various areas of somebody's lives. So, for example, their like daily activities, work, being able to socialize. It can have a negative impact upon people's relationships. So yeah, it can make it even harder to contend with. And what can happen is, as a result of that negative impact in those different areas, life can get further and further away from what it was and how you would like it to be. And often it's that gap between, if I do it with my hands, so this is where you wanted life, how you wanted life to go, then chronic pains come along, you're knocked off course, and it's that gap that kind of makes it even more difficult, because you find yourself here, and of course you don't want to be here, you don't want to have chronic pain, you don't want it to have this negative impact upon your life in these various ways. And so people think, understandably, well, I don't want to be here, I want to be here. And it's that gap that can then contribute to people being frustrated, angry, down. And I guess the other things to mention are, you said about, so people can feel quite anxious. So, and the anxiety can come about because, well, because of the fear of what's going on, fear of maybe causing there being damage in the body and causing more damage if they move and do things. Anxiety can also come about because, say if mobility is affected, people may worry about going out to a certain place, especially if it's unfamiliar. They worry if they're going to be able to get there, and whether the pain's going to increase and how they'll cope. People may also worry if it's like a social setting. They worry if anxiety is going to increase when I'm there, I'm not going to be happy and jolly and fun. People aren't going to want to be around me. Just like one more thing about the anxiety is that if life becomes quite restricted because of the pain, I've seen a lot of people who worry that, well, their life, there's not much to talk about if they socialize. They think, oh, I'm going to be boring, I've got nothing to talk about. So yeah, anxiety can come about for all those different reasons. I guess one of the problems about the anxiety is, okay, where that anxiety is there, and you've got that pain, the person may think quite easily, well, I don't want to face that. I'm just going to say no to that social invite, let's say. And that's fine to do every now and then, especially say if your pain's really bad one day. It's fine, understandable to take it easier that day. But imagine if that was the decision that was made every single time there was a chance to kind of go out and do something fun, connect with people, doing something enjoyable, being outside of nature. Life gets more and more narrow and restricted. And well, what happens to us if life gets narrow like that? That can be quite depressing. That can make us feel quite low and frustrated. So going back to my little hand diagram here, so this was how you wanted life to be. This is where you found yourself, where you've got chronic pain. But then if, again, understandably, if you choose to say, well, to not go to a certain something, life can get even further away from where you wanted it to be. So there's an even bigger gap between where you are and where you'd like to be. And the bigger that gap is, the worse we feel, the less fulfilling life is. And pain then has dictated your life even more. Yeah, it takes even more control over your life, which is tough.
Yeah, I really like diagram that you showed, actually, because it really is true. From your experiences, like in your kind of therapy services, what kind of things do you do to help kind of make that gap smaller, if that makes sense.
Yeah, yeah. So, okay. So this is actually from my hand thing. It's from a therapy approach called acceptance and commitment therapy,
Yeah.
or ACT for short.
Yeah.
It's not as well known out there, but it's actually been around for years.
Is it a third wave cognitive therapy? Am I correct?
Say
Third
that
wave.
again, sorry.
Third
Yeah,
wave. Yeah.
that's correct. Yeah. So there's another therapy approach called cognitive behavioural therapy, or CBT. That's more sort of commonly known, and that's actually a really good approach, therapy model to draw upon for therapy with people with chronic pain. And ACT is like a follow-on, so it's considered like a third wave sort of cognitive behavioural approach.
Okay, cool.
So this is I like to be really careful when I use the term acceptance when it comes to, well, anything really, but particularly chronic pain. So if I say it early on, people just want to punch me, because people associate acceptance with like giving up, giving in. But that's one interpretation of it. But it's seen quite actually it's quite the opposite in this kind of context. So what I sort of work with people on is, well, okay, you don't want to be here, so let's try and get you a little bit closer to being here. And so we'd work together to figure out, well, what does this look like? What's important to you? What are you doing less of? Or what would you like to be doing more of? And in a manageable way, how to get a little bit closer, how to reduce that gap. So this is where pacing is really key. So I don't know if people have come across that term pacing before. I don't mean pacing up and down when you're angry. It's a different kind of pacing. So pacing is around getting a really good balance between balancing your activity levels. So not doing too much, not doing too little, spreading activities out, even spreading the type of activity out that you do. So not to do a lot of physical activity in one go, not to do even a lot of activities that are emotionally draining in one go.
In terms of like in physio, we do use pacing. So like if a patient comes in and they're injured, for example, if they've been running 7 days in a row, rather than getting them out to go running like 7 days in a row, we'd pace it out. So maybe do once a week where they're doing light jogs, and then eventually pacing them so that they're doing like 5 days run in a row. So it's gradual improvement. Is that what you're talking about there?
Spot on. Yeah. So you can see that there can sometimes be overlap between what we both of us do. So we both do pacing, but I guess you might focus a bit more on like the exercise front. I can sometimes bring that into my work, but you can pace not just exercise, you can pace anything. You can even pace sitting down. So that's the other thing. It's good not to, even though you have chronic pain, it can be good not to sit down for too long, because that can actually exacerbate the pain in the longer term. That leads to more sort of muscle tension. And I guess the other key things about pacing is people often stop an activity when the pain gets too intense. But if that's happened, you've gone too far. We need to figure out ways to rest before the pain really kicks in. Because otherwise it will take, well, A, that's unpleasant for the pain to be up high, but it also takes longer for the body to settle back down again. So pacing allows people to sort of maximize their activity levels, so to do a bit more whilst minimizing their pain. So that's just one example of how to get there. But again, we've only got a certain amount of control sometimes when it comes to chronic pain and being able to get life to here. So we also work with people with figuring out what to do when there is that gap that's not within our control.
And like from your experiences, have you got any clients, obviously like real client, like don't mention names, but have you had any clients who you've noticed different changes, who have like unique experiences, or like just common patients that you kind of help them through? How would a normal therapy session go?
Sure. So, well, if I just explain maybe therapy overall, and then I can talk about some tools, and maybe even think about a client that I've recently worked with to help it make a bit more sense about what therapy looks like. So I've already mentioned CBT and ACT. So they're two therapy approaches that there's been lots of research and evidence to suggest that they're effective for a lot of people or actually with various emotional struggles, but also chronic pain. And I personally think I enjoy drawing upon the CBT. I think it's helpful for a lot of people, but also ACT complements CBT really quite nicely. But when working with somebody, your therapist will, once they work with you to gain a good understanding of your difficulties, they'll then be in a good position to figure out, well, what approach is good to draw upon? Is it CBT? Is it ACT? Is it another therapy approach? Or is it good to integrate different approaches? So I quite like to integrate CBT and ACT. Like I said, they complement each other, and I think they make therapy more effective when they complement each other. They're integrated. And so I would work with people to, well, firstly, just in the first session or so, I'd work with somebody to gain a really good understanding about what's going on, what are their experiences, what patterns are playing out, what kind of things are exacerbating the pain, and what kind of things help. And that's good to kind of work out, so we can work together to maximize those things that help you out, and those things that don't help or make things worse, we can try and minimize those or address those things. I'd also work with people to figure out the current coping strategies. There might be some that are helpful, in which case great, keep those up. We might even be able to build upon those even more together. But there might be some ways that people cope which help to an extent. You wouldn't implement those coping strategies if they didn't help to an extent, but there might be some downsides. So I'd work with somebody to kind of just think overall, is this really working out, or would it be good to adjust that certain coping strategy? And I'd introduce additional new coping strategies, hopefully.
Sorry, just to stop there. In terms of coping strategies, what kind of examples can you give us? That's okay.
Yeah, no problem. Yeah. So both like practical and what I call psychological strategies. Yeah. So when I say psychological, I mean maybe more so strategies that help improve emotional well-being. Therapies, it's tailored to the individual because everybody's unique, but there are some common concepts or strategies or tools that I introduce to people with chronic pain. So there's things like mindfulness, relaxation, mentioned about pacing, sleep management's really key. It can be good to look at diet. And then also just generally trying to find ways to improve emotional well-being in addition to those. And part of that might involve reflecting upon our thinking processes and our behavioural tendencies, and in what way they may be contributing or even helping our emotional well-being. So that's kind of like a way in to improve our emotional well-being. Yeah.
Cool. So just carrying on with that, like in terms of the tools that you were going to mention. So you'd say mindfulness, pacing, those kind of activities. And then in terms of giving that example of kind of a typical client that you'd get and how you manage that client.
Okay, sure things, So if I think about like a client that I recently worked with, maybe I'll just sort of start by saying like presenting difficulties and then where we went from there.
Yeah, that'd be really cool.
So person I've got in mind, she was a busy working mum, and she was a real doer, loved to help people, always on the go, really independent, and then chronic pains come along, and I guess the way she coped was, she didn't want to kind of give into it, and it's just not in her personality to slow down and ask for help, so she kept like powering through. But we kind of know that by powering through, that overloads the brain and the body, which then can exacerbate the pain. And so her pain would increase, and as a result she'd have to take things easier and bring her activity level all the way down, which obviously was tough for her. That's not how she normally is, and she's got all these things that she needs to attend to. So that was particularly frustrating. That was getting her down. and then things are piling up. And then so she rested during those periods, and when the pain began to alleviate, she kind of thought to herself, well, I need to catch up on all these things I've just been been left behind. And so she would kind of push and overdo things again. So that contributed to, we kind of call like a boom bust cycle of activity. So where activity alternates between doing lots and then that exacerbating the pain, and then having to do the bust phase, so having to take things easier. But then when things improve a bit, then the boom phase starts all over again. And also her life had become more and more narrow. So she kind of thought to herself, well, I need to prioritize things that have to get done, the most important things, like obviously like caring for the kids and housework, and keeping up her job. But then that came at a cost of, she didn't have enough energy, and also the pain was so high, she wasn't able to then socialize and do like relaxing things, enjoyable things. So in terms of the work that we did together, well, firstly, we just gained a good understanding about what was going on for her, what was maybe exacerbating her pain. And that's one of our ways in to try and address the pain. I also did a bit of, we call it psychoeducation, bit of psychological jargon there, but that's basically around understanding chronic pain and understanding the thing about pain doesn't equal damage, the role that our emotional well-being can play. So we looked at pacing, and we explored the factors that contributed to her pacing. So for example, like the thinking processes, so thinking to herself, well, I need to be strong, I must be independent, it's not okay to ask for help. So that contributed to her overdoing things. So we spent a bit of time together trying to address some of those beliefs, to allow her then to pace. We looked at mindfulness together. There's a couple of different ways that we can do mindfulness, and we can make it work for us. So people tend to think of mindfulness as close your eyes, listen to a track, which is great. It helps a lot of people. I really encourage people to do that who have chronic pain, but also people who don't have chronic pain. It's helpful for everyone. But there's also informal, I call it informal ways of doing mindfulness, which is around just kind of slowing down, doing one thing at a time. Because how often are we rushing around? We're doing one thing, don't finish that, jump to another thing, or we're washing up, brushing our teeth, and we're not thinking about what we're doing, our mind's somewhere else. And that adds to extra demand on our brain and body. So informal mindfulness is about slowing down, one thing at a time, and doing things mindfully, being in the moment. We looked at sleep management. So she was really struggling to get to sleep, and then she was extra tired the next day, and she found that when she was more tired, her pain was worse. So we found ways to address the busy mind to help to allow her to sleep better. I'm just trying to think of other things that we did. I don't know if that's enough.
There's quite a few things there actually, and I guess like there's a lot there. How do you normally help someone? How long does it normally take for someone to kind of take this all in? Because it's a lot. I assume you can't just give them all this information at once. Is this over months? Is this over weeks? How often do you see that significant change in someone who's chronic pain? Someone who's had it for so long. How long do you see that emotional change in them?
That's a good question. So firstly, it's about us working together. It's not that I'm just going to throw loads of information at somebody. We'd work together and figure it out together, and I'd introduce these different tools and concepts into our conversation, so people won't feel overwhelmed by this stuff. So it just kind of depends. So depends on how severe things are, how much of an impact it's having on somebody's life. Also depends on how, I guess, open somebody is to giving these things a try, to coming along and to the sessions, but also putting things into play between the sessions. That's going to determine the progress in therapy. But I'd say the minimum number of sessions for somebody to see some good changes is maybe about 6 sessions.
Nice.
But maybe I'd say normally it's between sort of 8 and 16 sessions.
Okay, yeah.
Yeah, but like I said, there's so many different factors that can come into how quickly someone can make progress. It just
Everyone is
kind of, it
different.
kind of depends. But what can happen is when someone's coming to therapy in the early stages, once your therapist knows you a little bit more and has more of a understanding what's going on for you, they can have a discussion with you about how many sessions roughly they think would be good to have. And as you progress in therapy, it's good just to sort of check in with each other
Hmm.
about how's it going and roughly how many it's good to aim towards.
Nice. And I think one thing you kind of pointed out is like the open-mindedness, being open-minded to therapy. There is a lot of stigma around, therapy, around actually going to see psychological help, that, they don't want to be deemed as mentally unwell. And especially like our clinic in Northwood, we have a lot of agents that come through, and we find it hard to explain to them the emotional side, just because they're more hesitant to take it in. They consider it as someone who's mentally unwell, and they don't want to be considered mentally unwell. So in that case, like, how would you help someone to see that actually there shouldn't be a stigma to seeking psychological help, and that it should be the normal, and that everyone has anxiety and everyone has some sort of pain, maybe not chronic, but everyone does go through pain, and it's okay to ask for help.
Yeah, yeah. I guess I would start off by helping someone to see, well, why it's so key to come for help, and also the role of the emotional well-being when it
Mm.
comes to chronic pain. So if I say a little bit more about that, if that's okay.
Sure, yeah.
So that's really important. And I guess this is something maybe I should have started off by saying.
Yeah.
So just because I'm here, I'm a psychologist, I'm talking about chronic pain management and coming to see me, or a psychologist for managing your pain, it doesn't mean for 1 second that I think pain's all in somebody's head. And that
Mm.
might have been a message that people have received elsewhere, which is really difficult
Yeah.
for that person. Um, your, your pain is very much real. If someone who has pain, they have pain. There is something physically going on in their
Mm.
bodies. But we know that the body can be so complex, it's kind of what we said before.
Yeah.
Body's really complex. Our science and technology is limited, so we can't
Mm.
always figure out, well, what is it that's going on. And also there can be different systems in the body that are involved. So it's not, so say with conditions like fibromyalgia, it's not that there's one system or like one thing in the body and that's, we need to treat that. There's lots of different systems involved. It is really complex. And we said before about pain doesn't equal damage. There's other factors that come into it. So with pain, 100% of our pain is processed in the brain. And I say that very carefully. Again, I'm not saying for a second it's all in your head, but that's what happens. There's a two-way pathway between like the pain site and your brain. Yeah, there's messages that go to and from. And we know there's so much research that goes into this that suggests that those signals that go from the pain site to your brain and vice versa are influenced by various factors. So we know there's so much research that suggests that things like our beliefs about pain play a role, our emotional well-being, how generally stressed we are in the here and now, or even how stressed we've been in the past can
Yeah.
influence our pain experience, how worried we are about the pain. So hopefully that helps to explain why psychology is involved, and also why it's important to attend to our emotional well-being as well as our physical well-being when it comes to chronic pain. It's so important to take this holistic approach. Yeah.
Definitely. And I think
Um,
it's being less and less of a stigma these days. There is like barriers being broken, but I think it's just getting that message across more and more, and helping people to see that it's okay to go for help. It's okay to go to psychologists and speak about emotional troubles that you may be having.
that's it. Yeah.
Yeah.
And I guess, yeah, I think like you said, some people think, oh, I've just got this mental illness and that's the reason why people are suggesting I go and get some help. But
Mm.
I don't care about labels. Even like say with depression, it's not that somebody has depression, they don't have depression. It's on a continuum. And if
Mm.
you've got pain, it's going to affect your emotional well-being. It is tough. You might have less patience, or you might feel a bit lower. Yeah, but that doesn't mean for a second that you're different and you've got depression. You're different from like the norm. It's not. It's just that you're human, and our emotions are on a continuum. Um, and I've said before, but it's understandable that pain has this negative impact upon various areas of our lives, and that's difficult. That can have an emotional impact. And I guess it's also good to reflect upon it, your own thoughts and beliefs about seeking help. So, for example, there's some people who think, well, I must be strong. Getting help means that I'm weak. Which isn't true. If anything, it's the opposite, because sometimes seeking help is the harder option. Yeah. So it's not a sign of weakness at all. And sometimes it is hard to deal with it on your own. And it is good to see somebody who you don't know, who's got experience in this, and you work together to figure it out and to manage it better. I just wanted to think there's something else I was going to mention there. The other thing is, sorry, even if you were to have, say, diabetes, or you've had like a cardiac problem, for some reason it's more acceptable to go and reach out for help when you've got those conditions. But why is it any different when it comes to chronic pain? Yeah, your pain is very much real and it is tough. So why not think about it like that? Look after yourself like you would if it came to like diabetes or cardiac problem.
Definitely. I think a lot of people with chronic pain also, like, a lot of family members, not intentionally, but they're quite dismissive, right? Because they're like, I'm going through this pain, and they're like, oh, it's just normal pain. Come on, get over it, get through it. And if you're going through that chronic pain, it's often good to go and seek help, like someone like yourself, because you would understand. You've seen patients like that before, and you would be able to understand what they're going through and help, again, deliver that individual care that they need, right?
Yeah. So when working with somebody, I'd kind of find this kind of stuff out, hopefully, and especially if that's a barrier to them seeking help, continuing with help and helping themselves. Because if you kind of listen to those messages around you, that's going to stop you doing things that actually might help you out. So I'd work with somebody to reflect upon that and how good it is to sort of listen to those messages around them. And I'd also work with somebody to maybe figure out how to communicate with family members and friends about their pain, how much to talk about it versus not talk about it. Usually it's good to get a balance. It's not good to talk about it too much, because it can then become somebody's like identity, and that's not good. And it's also not good to talk about it not talk about it at all, because I don't know, it can be helpful to an extent for people around you to know, so they can help you and support you, rather than feeling like you just have to power through and just carry on. That might lead you people to overdo things.
100%.
So it is good to try and find a balance. And if people around you are just giving you that message, just can't get on with it, I'd work with somebody to figure out, well, how can you have a good conversation, a constructive conversation with that person, so they stop giving you those messages.
Nice.
Yeah.
I think so. I guess to wrap up, we've covered a lot of topics. Is there anything, I guess, like if you had one message just to send someone who had chronic pain right now who's watching this, what would be that one message? Sorry to put you on the spot there. Yeah.
It's hard, one message, because and I appreciate that would be helpful if I had one key message. But with chronic pain, well, actually, I'd say having aiming for a holistic approach when it comes to your pain management. So and not thinking there's just going to be one thing, but keep in mind that it's really important to not just focus on like your physical well-being and like coming to you guys at physios and focus on that aspect, but taking this holistic approach and also attending to your emotional well-being. And I really hope that I've explained it okay, the importance of attending to your emotional well-being, even though it's a physical problem, but the emotions interact with your pain. Key message, I'd say, take a holistic approach when it comes to your pain management.
Nice. Thank you for that. Hopefully you guys have learned a lot. If you have any questions, do post it. If not, we can always message Amy after and send you any messages that our audience has. So ultimately, I guess, how can people contact you again? Just going through your, is it email, is it website? And of course, we're working with you as referral partners now. So if you are coming to us for chronic pain, for seeing physiotherapists, we will refer you to Amy and her team, who can see for further information, further help. So yeah, how can they contact you?
Okay, so various means. We've got a nice little website. So you can find us if you search therapy-central.com. That's our website. It'd be great if you can. Well, you can also email us, and that our email address is info@therapy-central.com. On our website, you can on our website, our contact details are there. So it's got our email address. We've also got contact telephone number, and there's also you can message us directly through that website. So yeah, and we tend to respond quite promptly. And just to say, once you do contact us, the first thing that we like to do is to have what we call a free telephone consultation. So where we'll find out from you just briefly what you'd like help with, what's going on for you, and we can tell you a little bit more about the service, how it all works, and then we can find a therapist that'd be well suited to work with you. Nice. And then just to mention also the discounts. So I think we said, haven't we, that if you refer anybody to me, we can offer 20% off the first 2 sessions. And there's also discount.
Of course, if you come to us, if anyone is going for psychological help and wants to kind of the physical aspect, you can come to us as well, and we're happy to offer 50% off the first 2 sessions. And then I guess we'll take it from there. So I think that's pretty much it. Is anything else you'd like to touch upon?
No, that's okay.
No. Perfect, fantastic. We haven't got any questions as of currently. Candice has said she's loved the webinar, and she said, yeah, chronic pain is so draining that it can limit your normal life drastically. So if you do have any questions, just pop it in to our email box and we'll make sure we'll get them answered. I've linked the website onto the comment section, so have a look and look out for hopefully future webinars like this touching upon chronic pain, and hopefully we can answer your questions. Thank you.
Okay, thanks everyone.